You have an amazing leadership because as an engineer, I think it's really important to understand how dystonia works. And it's at a level that most people or even physicians have no idea about. And so you have someone who understands that at the highest level. So incredible leadership here. So it is my pleasure to go over and introduce to you Daxxify Botulinum Toxin A. You may have heard of it, but this is really interesting and exciting development. More than that, though, I want to present optimism. Optimism in treatment, optimism in controlling symptoms. That's what I want to show today. And I say that because I think you will see here that we are now changing how we think about treatment and control of symptoms. And so today, we're going to go over 4 things. First, I will go over how we treat things now. What is the state of treatment? How do our patients live with this disease day in, day out? And then we're going to talk about Daxxify and why this is a new, exciting development. And then the third thing is we're going to talk about how Daxxify applies to cervical dystonia and how it can help us. And then lastly, we'll have a little video presentation. Okay. So what is the current landscape? So I think there are folks in the audience that can close their eyes and think about their treatment plan. They have symptoms. They might go and get, in this case, they might get neurotoxin, botulinum toxin. Their symptoms get better. Then it gets worse. You kind of wait until you got to get the next injection. You get the injection, you get better, rinse and repeat, on and on and on and on we go. That's kind of the, accepted standard. That's what we think about when we talk about botulinum toxin injections. But, we know how frustrating that can be. We know that our patients have to sometimes rearrange our entire life around these injections. I mean, if you have symptoms that are coming back right at a party, during a party, and you have to say, well, I can't function there. You see on the right side of the slide here, you may share some of the sentiment here where you say, 3 to 4 weeks before my next injection, just terrible, right? It's a roller coaster. Dystonia limits everything I do. Every activity is exhausting. I mean, these are the things that I hear from my patients. And this is really important because there are a lot of people with cervical dystonia, believe it or not. This is from the NSTA website, 90,000 people in the United States. And I will say that this is probably an underestimate. And there are people in the audience that will probably agree where you may have gone to somebody and say, I got a diagnosis, then another diagnosis, and then another diagnosis, and then finally a diagnosis of cervical dystonia. And so there's misdiagnosis and missed diagnosis everywhere. And so I do think that this is underestimated. The process of dystonia, the disease of dystonia is quite complex. Right? It's a series of circuits. There are circuits that are, there's an interplay, things that go wrong. But ultimately, in the end, what happens is that the muscles involuntarily contract. So you have these intermittent or sustained contraction of muscles around the neck. And what that does is that your neck starts to move in different ways. Your head might turn, it might tilt, it might flex, it might extend. Most of us, it'll be the combination of all these things. Okay. And some people have tremors because if your head's in a different position and you need to look straight ahead and your rest of your body's telling you, you got to stay in this position and back and forth, and you start developing these tremors. And then many people talk about the discomfort. Some people might have significant pain. These are the things, these are the consequences of dystonia. Now, thankfully, botulinum toxin has worked very well. It's been a safe and effective treatment for decades. But there are downsides. There are limitations to the toxins that we've been giving our patients. And we want to present that. we see that symptom reemergence is very common. We know this. Our patients tell us this. And it's incredible because it says, the majority, 66% of patients with cervical dystonia suffer reemergence of symptoms within 3 months, less than 3 months following a treatment. Okay. And this little graph right here, I would like you to commit to memory because we're going to reference it later. But I think people who are getting these injections here don't understand this, where you get an injection, it kind of starts working in about a week, it peaks at about 4 weeks, and 8 to 10 weeks, you start to say, I might have a little bit of symptom here, a little bit of symptom there, and it starts to go away. We know this cycle. This is the cycle that we typically talk about. Studies show 22% to 45% of patients wish that they can get treatments earlier, less than 10 days. And I know there are a lot of barriers to that. So we understand the pain points. And there was a international study published in 2021. One of our colleagues, Camilla, presented this where they did a survey and they said that, patients reported coping with symptoms for an average of 31 days between injections. Now we got to step back and think about this. That means that in a given year, that's about 4 months, right? So, 8 months, we'll take it, right? 8 months of control, better than nothing. But what about those 4 months? Our patients are thinking about it. It can control our life, how we plan things. And so we recognize that the symptoms on the right side here in this graph, neck pain, muscle spasms, these are the things that are really affecting our patients' quality of life. So now we want to explain why Daxxify Botulinum Toxin, or Daxxify, is an important tool for us. It is a really novel formulation, meaning it's a brand new approach to delivering neurotoxins. And here is the Daxxify vial. And I do want to mention, this is more for providers who give this injection, but I got to say, Revance knocked it out of the park in thinking about every little detail. The vial, finally, you can put the needle in and draw everything out. The vacuum has been adjusted so that you don't have to break infection protocols, so you can actually pull it out without doing all these crazy things. So hats off to them. Even the vial, they thought about everything. But what's inside that counts, right? So let's talk about that. So you have the toxin in there, and that's not new. We know about neurotoxins. But you have this very interesting stabilizing peptide on the right side. Make a jump, but in the right side. That's something that I would like to talk about. That is what makes Daxxify unique. And that's what makes Daxxify really, really interesting for us in managing cervical dystonia. It also has the polysorbate 20, which is something that we use to keep it from sticking from the vial. And then the histidine buffer, which is to help with shelf stabilization. But that's it. This is what you get. It's really simple. But that peptide on the right is why I'm here. So let's compare Daxxify to all the toxins you've been talking about in the last several decades. So number one, you have the special peptide, and I'll get to the details in a little bit. No accessory proteins. So Daxxify shares that trait with Xeomin. The reason why that's important is immunogenicity issues that can come about with excess proteins that are not needed. No human serum albumin. I want to pause right there and focus on this a little bit. All the other toxins use human serum albumin, which is a human blood product component. Now, there are some of my patients who have religious restrictions on using human blood products. There are people who just don't want any medication with human blood products or components. We don't have to deal with that anymore. Daxxify does not have that. So we don't have to have these caveats or discussions about that. Some people don't even realize that that's what's in the other toxins and fail to talk to our patients about it. But, that is really important. No animal derivatives. We joke that this is like the first vegan toxin. So, no cows, nothing. Okay. The next two are more for providers. You don't need a refrigerator, so you're not, worried about the refrigerator breaking down and losing all the toxin. And then after reconstitution, if you put it in the refrigerator, it'll even stay for 72 hours. And this is the first toxin made in the United States, right? So made in the USA. And the funny thing is that their company is like 20 miles from the house. So amazing. So this is they called it a cell penetrating peptide, but what it does is that it acts like a magnet. So what they did was they coated the toxin, it encapsulates the toxin, and it creates this charge. And when injected, it kind of hones in on where it's supposed to go, and it stays there. And what that effectively does is that it allows higher concentration of the toxin to go in where it's supposed to. And I know there are smart people out there that are already thinking, wait, so if it stays where it's supposed to, maybe the safety profile is also better, right? Because if you inject it in one place and it stays there instead of going all over the place, that's a positive thing. And this is what it does. This is why this is really fascinating, because for the first time in history of toxins, we have something other than the toxin that's changing the outcome for our patients. So this is really, really fascinating. It delivers the Daxxify to the precise location, right? This is why it's so unique. And so they have this proprietary peptide. It anchors the toxin to the target. It creates stability. That's why you have, you're able to use, no animal products. You can still use it for 72 hours. There are a lot of advantages. And this is why it differentiates itself. It's differentiated formulation compared to the other toxins. So let's talk about how we can use Daxxify for cervical dystonia. So this toxin, as you can imagine, it does reduce pain, severity, and disability. We know this. But what's really fascinating is that the average time for symptom return for this toxin is 16 to 18 weeks. Now, this is when I asked you earlier to remember that little graph. That was 8 to 10. We're getting to 16 to 18. That's amazing, right? And now that opens up lots of different possibilities. If my patient is waiting 2 weeks, waiting for that next injection, if it lasts 16 to 18 weeks, it gets them over that hump. It gets you there. And then it also allows you flexibility, right? So let's say you have a party at the 13th week and you get your injection usually at the 12th week. You're miserable for 2 weeks and another week. You may not have that problem if the toxin lasts longer. Okay. And we are seeing, in the real world, many, many patients experiencing continued improvement as we make even more adjustments. They're getting better and better. So I want to talk about the clinical trial. And this obviously led to the FDA approval. As you can imagine, it was far superior to placebo, very similar to other toxins in that it improved quality of life. It was, it's no contest compared to the placebo. But that's not the most important thing. This graph right here. Now, again, I'm going to ask you to think about what I showed you earlier. When you look at this graph, I want you to look at where the 8 to 12 is. Okay. The other toxins, you start to have decreased efficacy, increased symptoms around that period, 8 to 12, 8 to 10, and 10 to 12. Here, you are getting 50% efficacy at 16 to 18 weeks. And then pushing that even further, 20% efficacy remaining at 20 to 24. What happened was that graph shifted to the right. Shifted that way, right? Again, that starts opening up a lot of possibilities. This is another compelling slide. So this is the Aspen open label study. So this is where the doctors can make adjustments according to what they want to do. Again, 26% of patients were saying the toxin was lasting 16 to 18 weeks. But that's not the most important thing about this graph. Everything to the right, 19 to 21, 22 to 24, 25 or more, that's about 60% of patients are going beyond the 16 weeks. And if we were to nitpick, when we start to say incorporate the 13 to 15 people, that percentage goes up, 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 up. And we've never seen that before in the other toxins. Now, I kind of alluded to it, right? The toxin and the peptide makes it very accurate. So it is not a surprise that no serious side effects were reported in the Daxxify clinical studies, right? Instances of side effects remain very low, and this is what I'm seeing in my clinic as well. We do have to mention that, much like all the other toxins, Daxxify also has a label, with potential side effects like headache, which is always weird to me because we use botulinum toxin for migraines and headaches, right? But, it's one of those things that are listed. Muscle weakness, obviously, right? We're using neurotoxins to weaken muscle. Injection site pain, injection site redness, again, expected. And then the other weird thing, upper respiratory tract infection. It's kind of weird things. But I look at this and I say, well, majority of my patients are not going to have any of these. And for my Daxxify patients, it's been very, very effective without mentioning in terms of actually any side effects, at least for me. So I want to talk about the preview early experience program. And I was part of this. Now, Revance did something very smart. They got FDA approval for cervical dystonia last year. So why are you hearing about it now? And the reason is they knew very astutely that the clinical trials do not reflect real life, right? In most cases, those are very restricted, very controlled things. What happens in the wild, right? And so what they did was they picked a bunch of physicians who had, high volume of patients and who had, great expertise in injecting cervical dystonia. And they said, we want to gather evidence on how best to use this new product. And they were gathering information for a year. And they took 31 physicians. They treated 224 patients. 68% of those patients had wearing off early. And so we were able to get hands-on experience doing the small adjustments needed, try to fine-tune the treatment so that we can give the best possible outcome. And now with that understanding, with that knowledge, Revance and the company can now go out to the broader provider network, all the other neurologists and other movement disorder specialists and doctors, and say, this is an optimal way to help our patients. This is what they do. And so I was very lucky to be part of this network of physicians where we were able to talk to everybody, share our experiences, optimize the treatment. And it's been a really great success. And so what we learned was, as you can imagine, real life is slightly different. And during the program, we realized that when we counsel our doctors as well as patients, we say, when you are switching from other toxins, you have to understand that we have to make some adjustments, right? You have to have a little bit of patience for that big payoff that we're looking for. And so a lot of the times our providers will start at a conservative dose with you. They'll negotiate that with you, but they will have to make adjustments. That's what we found out. 65% of us had to make the adjustments. But once we started to make those adjustments, we started to see this amazing length of efficacy. And I will say, just, for my part, I've had amazing success. And majority of my patients are now really enjoying that 16 to 18 week efficacy. And so this is what we've learned. And this is what we're teaching other doctors. As you can imagine, during all this process, Revance is building up patient support. They have a field of reimbursement specialists. They have the J code. They launched their patient affordability programs. They've established access to major commercial plans, Medicare and Medicaid. They really went above and beyond during this period of learning to make sure everything was set in place so that when my patients are ready to try this new toxin, the providers won't have a headache, no pun intended, headache of getting through all of this. We have our Revance team in the back too, but they have all the clinical and operational reimbursement resources for Daxxify already ready to go. The preview program that I mentioned really gave us a lot of information about optimizing doses, how do we counsel our patients and physicians. And we are hoping that more patients will also see the benefits and really experience the good days that my patients are experiencing now with Daxxify. And so just as a summary, this is a novel formulation. This is brand new. That peptide, really fascinating. It was worked on by actually a professor, cell biology professor at UC San Diego. So incredible technology there. It gets sustained symptom control. Try to show that how that graph really shifted to that right, lasting longer. And then because of the properties of that peptide, you get these excellent safety profiles, low risk of adverse events, including muscle weakness as dose is titrated. So this is where we have a little bit of video.
The onset of pain started in 2007. I noticed I had muscle spasms during the day, and I attributed it to really poor sleep at night. So I started spending a lot of money on trying to find the right pillow. Before cervical dystonia, I never thought twice about what kind of job I needed to be in. And I was able to race mountain bikes and cyclocross. And I also love swimming. And I've done some open water swims. In 2021, I became fully disabled and couldn't participate. I couldn't work. Cervical dystonia definitely decreased my overall quality of life. I'm grateful to have support in my home, but I've lost friendships and my ability to function, and I lost a lot of things that are important to me that I take pride in. And there was a lot of grieving that I couldn't participate in life. I went to several doctors, and the second neurologist I saw diagnosed me with cervical dystonia in 2023. The first treatment I got with the botulinum toxin, it took 5 weeks to feel improvement, and the improvement wasn't significant enough to allow me to do more activities. The biggest thing I could do was sit in a recliner and try to support my neck, and I would feel less pain as long as I didn't move my neck. After each injection, my symptoms would improve, only for about 6 weeks before they started wearing off, so I never got the benefit of a full 12 to 14 weeks. I reached out to the physician in my doctor's office and asked if there was anything they could do, and the physician told me about Daxxify. My doctor told me, in his experience, patients have been maintaining benefit to 12 weeks and beyond. After my first injection, I noticed some relief, especially in some deep spasms on the right side of my neck, and I started accepting full-day assignments as a substitute teacher, and it had been 3 years since I was able to work a full day. I was able to return to swimming. I increased the amount of time I spent in the water, and in March, I completed a swim for St. Jude. I'm able to drive a lot more. My commute used to be I could only drive 10 minutes one way. Now I can drive 25 minutes one way, work a full day, and still be able to drive 25 minutes home. Being able to drive, there's a huge sense of freedom. The amazing thing is I can commit to assignments and even family commitments more than 2 weeks in advance and know that I can follow through. My treatment with Daxxify has been different. I know that from one day to the next, I'll be able to function and be able to engage in life. With Daxxify, I know that I can have good days.
All right then. Thank you so much.
You said it's FDR.
Yes. Oh, yes. This is FDA approved for cervical dystonia. Yes. It's been that way for a year. Yeah. All right. Thank you so much.
Thank you.
Of course.